And Dr. Markley, I didn't ask you beforehand. Do you want me to share the slides or do you want to do it? Either way.
I can do it.
Okay, good.
Oh, I say that now, but if you can't see them in a couple of seconds.
Okay.
I have to make an announcement too that they'll be kind of like coming in and out of Project Echo today with the cases and everything because there's also something going on my service that I'm kind of having to bounce back and forth between. So just want to make everybody aware.
We'll talk about you when you're not here, but thank you. It has come up. It's
All right. And I muted myself.
not
Can
in
you hear me now?
presentation mode yet, but it's up. There you go.
Okay, perfect. All right. So can you all hear me? Okay. So I am Dr. Markley. I am board certified as an addiction medicine physician, but I'm also a child and adolescent psychiatrist, general psychiatrist, and pediatrician. So I come to you from several angles today, talking about the psychological and developmental impact of THC and marijuana abuse in adolescents. So I'm the Division of Medical Coping and Addiction Medicine at Akron Children's Hospital, and we'll get started. So today I want you to kind of recognize some evolving trends in youth marijuana and THC abuse. THC is a psychoactive compound within the marijuana plant. The reason I list them separately is because there are, as the picture shows, now vaporizable forms of direct THC that don't really include marijuana smoking. We're going to talk about why adolescents are developmentally very vulnerable to THC use and its effects. And we're going to identify the developmental, psychiatric, and social sequelae that are occurring as a result of these trends. So I'm going to say a little bit about this survey, which is called the Monitoring the Future survey. It's been going on since, I think, 1972. And they've tracked a variation of multiple youth over the years regarding behaviors, attitudes, values on substance abuse. They also do an adult monitoring the future survey, which looks at adult substance use. So the results that they give us are from students in 8th, 10th, and 12th grades. Some of the results have been limited, especially in the last 5 years due to the pandemic and people not being in school. So some of the trends that I'm going to tell you about may be affected by just lower participation. So in 2019, we started seeing a spike in younger kids using marijuana. So if you look at 2017, 2018, 2019, as legalization proceeded and access to high potency concentrates increased, we started seeing more and more youth at younger ages start using THC. Now, one thing that you'll notice is that the line for those like 12th grade has been fairly consistent. The one thing I would like to give as a message today is that I think that we've all kind of have this normalized view of teens will be teens and they're going to go out and do crazy stuff and experimenting with drugs is just a normal part of adolescence, but it's not. And while 35% is a large number who have experimented with marijuana in the past year, the thing is that 2/3 of the 12th graders didn't. So it's actually more the norm to not use than it is to use. And I think that it's important to point that out to our youth that we're seeing and not only address that they are using, but address when they aren't using and really give them positive feedback and kudos for not using. So in 2019, we saw the second largest one-year jump for any substance in the history of the survey. So in the past 40 years. And that was because of vaporized THC and nicotine. Nicotine had been going up. Interestingly, smoking cigarettes was going down, but vaporizing these substances was really hitting, no pun intended, a high. 1 in 4 students in the 12th grade, 1 in 5 in the 10th grade, and 1 in 11 in the 8th grade reporting vaping nicotine in the last month. And THC vaping, 4% in the 8th grade, jumped to 12% in 10th grade, jumped to 14% with seniors. So we saw this huge jump. And the thing to know about the different formulations of marijuana, I'll just say quickly, back in the 70s, your average street weed was about 2% THC. In the 90s, it was between 3 to 5%. In the early 2000s, we bumped to maybe 5 to 10%. After things started being crossbred with quote unquote medicinal strains, we're now looking at usually an average of 25 to 35% for just general weed on the street and up to 45% smokable. And these concentrates, which are either vaped or used as dabs or wax concentrates, usually contain between 80% and 100% pure THC. So when people are using their own past pot use, like parents or grandparents, as a reference for what their children are doing, for me, it's helpful to point out that you would have to sit and smoke sequentially 20 to 30 joints from 1975 to get the same amount of THC as you get off of one hit from a THC vape. So then the pandemic happened, and it was interesting because the prevalence declined. It went up, and then went down, 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 down. And one of the thoughts behind that is that the kids weren't in school. So in my patient population, the amount of kids who use in school both vaping nicotine and THC is incredible. Not just even in the bathroom, but actually in class. They can do, it doesn't, most of the nicotine that isn't flavored, the vapes don't smell, the THC pens don't smell, and they'll literally sit in the back of the classroom and vape THC. So, but when they weren't in school and they didn't have access to people, the prevalence went back down. I think there was also some trepidation about doing things that could affect your lungs in the middle of a respiratory virus outbreak. So the use didn't go down like under where it was before the rise pre-pandemic, but it's stabilized at about 30%. However, people started to get creative and they started dabbling with what they could get a hold of in their house. So in the 2022, there were statistically significant increases in 12th grade use of cocaine, hallucinogens, and heroin, as well as prescription opioids. Also, one of the thoughts behind this is that you used to kind of work your way up with pot. Maybe you smoked once on a weekend, then maybe every other weekend, every weekend. You had to work to get up to every day. But with the concentrations that kids are getting exposed to right away, they're becoming dependent on it very quickly, and they are escalating to daily use very quickly from experimentation. And so once that high isn't enough, they are kind of moving on to other things. There's this fallacy that the gateway hypothesis has been disproved. It's not. It's just that in the lay press version of the gateway hypothesis, which was if you ever hit a blunt, you were going to end up a cocaine addict living in a van by the side of the river. That's not true. But we definitely know that people who use early on in their adolescence, the earlier you use, the more likely you are to have any substance use disorder. So the other thing in the adult literature that I thought was really interesting, and because these kids are living with parents, they're living with older sisters and brothers, adults. In young adults from 19 to 30, reports of past year marijuana and hallucinogen use, as well as marijuana and nicotine vaping, significantly increased with them hitting historic levels in 2022. So adults actually continued to rise. And right now, even in adults from 35 to 50 years old, the trajectory of marijuana, hallucinogens, and THC concentrates is at an all-time high. So now there are multiple ways to consume cannabis, and this is leading to several young people. We think about the earlier your brain gets exposed to these substances, the worse off your course of illness can be. And we have kids coming in at 2 months or 2 years old, 3 years old, having eaten THC candy, ice cream, drinking THC laced soda, getting gummies. So it's really ridiculous. If you ever, this is from the Weed Professor, but if you go to allbud.com, um, it's a sales site for everything cannabis, and it's just incredible the things that are on that site and the things that kids can order. The other thing is it's extremely easy to conceal. So these are USB sticks, and these are dab pens. So these are full of THC concentrates. Do you think most parents can tell the difference? I do not. So some basic concepts. Typically young adolescents experiments with what's around the home and the environment. I cannot tell you how many times parents tell me, well, I tell them that I can smoke weed because my brain's developed and their brain's not developed, so they can't. That doesn't register with a teenager. All they see is you modeling that behavior. So you cannot use in front of your children if you do not want them to use. Early use tends to occur in the context of experimenting with peers, but also tends to happen within families. So from what I'm going to tell you, the old practice of, well, it's fine to, let my kid drink as long as they're at home. No, that it's actually not. Perceived harm is a deterrent to use. So with legalization efforts, it's sending more of the message that use is safe, which it is definitely not. And the marketing of nicotine, vaporized nicotine, was specifically geared to youth. And the interesting thing is, if you look at who is behind the lobbies for big marijuana, it is actually big tobacco, because they're losing a ton of money because people aren't using cigarettes anymore. So the adolescents, their ability to get a hold of things and not get caught, because these things, you're not going to reek like cigarette smoke, you're not going to reek like marijuana smoke. Just by demonstration of their family and friends using it, that the use is becoming extremely problematic. So legalization and suicide rates. So when parents tell me that they're okay with their depressed kid smoking pot to feel better, but they're not okay with their kid taking antidepressant, I point out that while antidepressants have a black box warning for increase in suicidal thoughts, it's not suicidal action or completed suicide, whereas marijuana is directly linked to completed suicide. So in legalization states, they looked recently, this just came out January 2024, they looked at states with no legalization and the suicide rate, medical marijuana legalization, and legalized recreational marijuana. And you can see that the suicide rate in the states with recreational marijuana is almost double that in states with no legalization. It was consistent through female identifying youth throughout the age groups of 12 to 25 years throughout, but both female and male identifying youth age 14 to 16 years, the marijuana and recreational marijuana states were 9% higher than medical marijuana states and 14% higher than no legalization states. And they felt that that was due to the adolescent neurodevelopment cognitive vulnerabilities. So quickly, what makes them so vulnerable? One, their prefrontal cortex, kind of like the way I think about it, is that your brainstem, your visceral reactions, your protections, your fight or flight, all of that is your emotions. The gas pedal is fully developed by the time you're 12 years old. The brakes, the common sense, the determination of consequence is not fully developed until your mid-20s. So on a good day, an adolescent is driving the car with the gas pedal engaged, and they can only tap the brakes about 50% of the time. So they are driven by urges, by pleasure. They have a weak common sense filter, and they also take cues from their environment. They're very much more sensitive to cues for their environment. So when they're around peers that are using, they're much more likely to indulge. So why do we care? Because the age at first use and later risk of developing a severe substance use disorder increases substantially based on when people take that first drink or smoke that first joint. So 17% of people with a substance use disorder long term started at age 13 or above. So less than 10% who took their first drink at 21 and older led to alcoholism. With marijuana, 5% who didn't use till at least 21 developed a disorder. But those who used less than 13 years old, you're looking at 20% developing a disorder. So delaying use, even by a few years, greatly reduces the chance that someone will develop a substance use disorder. So what happens when kids get to using these substances early? And I will say that most of these studies have been done on smoked marijuana from the 1970s to the early 2000s. So we can't even really say what the effects will be of the will they be amplified by the use of these high concentrates that they're using in start. So there's cognitive and memory deficits, educational failure, increased school dropout, unemployment. They have higher risks of being arrested for domestic violence, relationship difficulties. There's an increased prevalence of psychotic mood and other addictive disorders, which I'll show you. And basically, the odds of negative developmental outcomes are increased in use with early onset, persistent, high frequency, and high potency cannabis use, which suggests a dose-dependent relationship. So it's bad, but we anticipate it getting worse. So I'll just quickly mention the Dunedin study, but the punchline is that they studied 1,000 New Zealanders from birth until age 38. And they looked throughout their lifetime at how many times they had been diagnosed with having a cannabis use disorder. And they tested for IQ, neuropsychological indices. They even corrected for, environmental factors as well. And what they found was when their adult IQ was tested at 38 years old, the heavy and most persistent adolescent onset marijuana users had an average decline of their IQ by 8 points from childhood to adulthood. I'm not sure how all you guys feel, but I feel like I need every point that I can get. So the non-users in retrospect had actually gained a point as they got older. So even after they said, okay, well, what if we take out all the heaviest users? They still saw a decline in those who had used in their teen. And what's more, the drop in mental function seemed irreversible even after the kids had quit cannabis. So studies point to a vulnerability of the adolescent brain, not only to functional loss, but development of long-term disorders. So again, delaying exposure to substance is key to prevention of long-term substance abuse and sequelae. And early exposure to high potency cannabis problems is especially concerning, and that's unfortunately what people are using. So quickly just mentioning the psychiatric sequelae in the United States, among those with mental illness, and many people don't just have one thing. With serious mental illness or serious substance abuse disorder, there's a large crossover. So in acute toxicity, in 2018, Dr. Hissett can attest, we started seeing a surge of kids coming in acting like they were on PCP, like they were like Hulk smash. They were destroying things. They were out of control. They were difficult to sedate. It took multiple days of antipsychotics to get them under control. And at the end of the day, they had used THC. They had used these high potency THC pens, and we unfortunately have not seen a huge decline since then. So the vaporized products especially have been associated with rapid onset of mood and psychotic symptoms, even upon novel exposure. So THC in high doses, so THC has its own receptors, but it works in a way that it kind of modulates the other the other neurotransmitters in the brain. So you usually think about dopamine, but it can actually alter the function of the other neurotransmitters if you light up the brain with enough THC. So you can get serotonergic activity, so these kids can act like they are actually having an acute mania. And the effects can be prolonged and again require acute psychiatric hospitalization and antipsychotic medications to stabilize. And in the past, you could usually get them off the medications. These days, not so much. So these are just a couple graphics I will show that compare. In the red, it's kids with no marijuana use. Any marijuana use is blue, and daily or almost daily marijuana use in green. And they're looking at youth who abuse opioids, alcohol, cocaine, meth, those who have had a major depressive episode, or past year severe mental illness. So the thing to point out here is that it's definitely much worse in youth who've used marijuana, but actually there's not a huge difference between those who use daily and those who use occasionally. It really seems to mess these kids up. So again, major depressive episode status, comparing those who have used marijuana in the last year, it's 25%. So it's a two-way street. Psychiatric symptoms predict problematic cannabis use, and they predict the perception that cannabis use is harmless. A lot of people will say that their mental illness is treated by cannabis use. There is actually no evidence to support that other than weak evidence that it may improve sleep in veterans with PTSD. Repeated studies have shown synergistic effects that as cannabis use worsens, so does mental illness, and as mental illness worsens, cannabis use escalates. So there is no evidence thus far for any disorder for recommending marijuana for mental health that would outweigh potential harms. So when we look at suicide, like I said before, these are people with no substance use and substance use disorder, 12 and older. And you can see, obviously, there is a risk. These are multiple studies. It's a meta-analysis showing if you're on this side of the line, the study supports there being an increased risk of suicide with marijuana use. So most studies do support that. And an interesting trivia point, the most common substance found in children who have completed suicide in the state of Ohio is marijuana, and has been for years. So in conclusion, early exposure to substances leads to an increased risk for developmental stagnation, decline, and substance use disorders, and acute and chronic psychological and physiological illness. And unfortunately, there's decreased awareness of the risk and increased accessibility to high potency cannabis and THC concentrates. So our public health initiatives and our messaging to our patients need to focus on education about the risks, and that we should be confronting and correcting public notion that substances like marijuana are a natural option. It is the most genetically modified organism on the face of the planet for treating mental illness, especially in youth. And that is all I have. Thank you so much.